Hello everyone. Let's start our today's topic, that is the Institutional Review Board or Independence Ethics Committee. IRB or ICE, IEC serves as an independent body that reviews, evaluates, approves, and decides on the scientific and ethics aspect of the clinical trial protocol, as well as the benefit and risk to the study participants. Main purpose of IRB is to protect the right, safety, and well-being of the subject to participate in a trial. Compositions of IRB. It consists of who collectively have a qualifications and experience to review and evaluate the science, medical aspects, and ethics of the proposed trials. And it also includes lists at least 5 members, of which at least one member whose primary area of interest is non-scientific, and at least one member who is independent of the institution trial site. What are the members of IEC? Chairperson, one or two basic medical scientists, the clinician, one or two clinicians from various institutes, one legal experts or a retired judge, one social scientist, one philosopher or ethicist, one lay person, and member secretary. Then, what are the responsibilities of IRB? Safeguard the right, safety, and well being of the trial subjects. Review a proposed clinical trials with a reasonable time and document its view in writing. Conduct a continue review of each ongoing trials at least one per year. Provide advice to the research on all aspects of welfare and safety of the research participant. Ensures that information regarding payments to subject, including the methods, amount, schedules of payment, is set forth in a written informed consent from, and any other written information is provided to the subjects. Then, what are the procedures of investigational review board? First is determine its composition, authority under which it is established. Schedules, notifies its members of and conducted its meeting. Conductor initials and continuing review of trials. Then specifies that number of subjects should be admitted to trial before the IRB or IEC issue its written approval or favorable opinion of the trial. Specific the information that is investigator should promptly report to the IRB or IEC, like deviation from protocol, adverse drug reaction, etc. What are the maintenance of records of IRB? IRB or IEC retains all relevant records, for example, written procedure, list of occupations, affiliations of members, submitted documents, minute of meetings, etc. For a period at least 3 years after completion of trial, and mask them available upon request from the regulatory authority. IRB and IEC may be asked by investigator sponsors or regulatory authorities to provide copies of its written procedure and membership lists. And IRB or IEC reviews the appropriateness of the clinical trial protocol, as well as the risk and benefits to study the participants. It ensures that clinical trial participants are exposed to the minimal risk in relation to any benefits that might result from the research. There are two types of IRB or IEC. First is a local IRB, or second is central IRB. Local IRB are functions of the academic institutions that conduct research and review only their trials. Central IRB provides review services for multiple entities. Next, IRB review processes. In that, first, complete the IRB request for review. Second step is a or process submit the request documents and CITI to IRB at the rate ualar.edu. Receive IRB reviewers feedback in 10th business days. It is the third process. And last one is a possible decisions, that is approved NHPR for the review or full board. IRB decision is required prior to contacting the participants or collecting data. So this is all about the IRB or IEC.